Hi guys, welcome to the latest episode of Swan TV. I am here with Ollie Matthews, functional medical practitioner,
functional
medicine practitioner, and
health coach.
There we go. He's here. How you doing?
I'm really good.
Good man. Thanks for coming to see me.
Appreciate it.
It's been a long time coming.
I know. We just keep missing each other in there.
We have, but we're here now, which is good. So let's start. Talk in a nutshell, I suppose. Can you give a little bit of an overview on what it is you do and what you're offering?
I work with people that are stressed out, that literally pushing their health to the side. This is a way I've described the medicine that I do is like we have like the first medicine 1.0, which is basically like years and years ago when like, you got a cut and they chop off your leg, that sort of thing. And then there's medicine 2.0, which is basically where we are with Western medicine now, and then there's a 3.0. And if we look into the analogy of there's eggs coming from the roof, someone's throwing them over. Medicine 1.0 is just clearing those eggs up.
Okay.
Medicine 2 is trying to catch the eggs.
Okay.
But I'm going to the roof, finding who's throwing the eggs and stopping them from throwing them.
That's a lovely. I like that.
Yeah,
that's a good analogy.
It was taken from a colleague as well, so
I'm
not going to take full credit for that.
No credit taken. That's good.
Like it. Yeah.
So that's it. You are there on the roof.
Yeah, we're trying to
find out who's throwing those eggs.
Yeah.
Okay,
so you don't get egg on your face.
Functional medicine, you talk about. What do you consider to be functional medicine? What is that? What do you look at that?
It's looking at lifestyle choices, looking at nutrition, so the things that are causing stress, your environment, and using we're not using medicine as such. We're using food as medicine, and also what we call nutraceutical supplements, which are some of them are medical grade, and you have to have insurance to. I don't want to say prescribe as such, but to give them to a client, and some of them are substitutes for some medicine as well. Like you've seen things like metformin prescribed for diabetes, but berberine, which is a more natural side of things, a supplement, has actually been shown to be just as good without the side effects. So we're looking at better approaches to say that here's a symptom, say it's a headache, and you take a paracetamol. We're like, okay, that person's actually dehydrated, so let's get them hydrated and get the water to do the job, so they don't need the paracetamol.
That's the front of the bridge.
Yeah, exactly.
Makes sense.
Exactly.
It makes sense. And is it you talked earlier about predominantly stress?
Yeah.
Is it more than that, or is that where you really focus your time and your attention? Is in the stress, what's causing the stress, etc.
Stress causes pretty much every condition when it comes to health. Like, it's some form or another, whether it's stress on the cells, stress on the brain, stress on the skin. Any condition is pretty much caused by stress. Okay. So it's looking at what are those, like, what is the cause of stress? Is it your environment? So have you got mold around you? Are there loads of toxins, like fumes, pesticides here in Norfolk? Like, we think it's a really clean air, but it's one of the most toxic air.
Everyone leave Norfolk now. Leave Norfolk now.
We're all right.
We keep saying it's lovely.
We
keep saying it's lovely, but it's not really.
So it's very much, what can we do? We're not going to get rid of toxins, our exposure to it, so how can we make sure our body can detoxify them so we don't get the brain fog and everything like that? And the same with things like blood glucose management, and we're on a roller coaster of blood glucose management all day long when it comes to like loads of carbs, low protein. So what can we do to improve that?
Okay. And what do you see are the main sources of stress from the people you work with and the research you've done? What do you see as the key drivers?
I think there's kind of self-pressure. When we think about people that are driven, like yourself with businesses, you're driven to push this business up. And I work with a lot of directors, a lot of business owners that we're looking to get to that next level and the next level and the next level. And it's a case of looking to make money to do things that make you happy, rather than doing things that make you happy to make money. Which I'm in a lucky place where I can do that, but it still can stress me out if I have a lot of complex cases. I have to then take care of myself. And I got to a point last year, and this is kind of really relevant when we look at I had my most successful year last year, like December to December as a limited company, and it was great. And I thought, how can I better that? But my goal of bettering that was saying, like, can I get to like however much, like $250,000, my turnover, that sort of thing, and like increase that way. Actually, can I earn the same or maybe a little bit less, but work half the time and not travel as much?
Got some time.
Yeah, exactly. So having more time to spend with the family. And you've heard the story about my dad, and a lot of people may have heard me speak, but my dad died when I was 15, and he was a caravan sales manager, then went to caravan parks, and he was basically headhunted to turn him from like nothing to something. And he wanted to retire at 55. I remember him saying, I got this picture of us like in this like garden chair, like my nan's there, aunt and uncle, and it was like the last picture I had with my dad. And it was the May, he died in July 2001, and it was May we took this picture, and he said, just going to do a few more years, so I'll retire at 55, so I have an early retirement, come back to live in Norwich. He was then living in Colchester, and be able to just like get a part-time job and quality time. But he died at 47, and we're looking at kind of compounding this time so we can retire early, but we're pushing our health to the side. And we look at health as like we have this lifespan, so we want to live longer, but actually shouldn't we live longer with better health, rather than like life goes on like that and our health dips when we're like 40s, 50s, 60s, it just dips. Can we not actually keep them close together, and then when we get to really, really old age, we dip quickly. So actually we don't just have a poor quality of life.
Because what you're doing yourself in the practitioner way, is it relatively new, or has this been going on for years? Would your dad have had access to something like this, or was the information just not about? Is it?
It would have been, I don't want to say underground, but it would have been known about. This kind of alternative medicine, homeopathic medicine, holistic medicine, whatever we want to call it. But it's getting more and more recognised. Like more in the Western medicine might call it like integrated medicine, integrative medicine, but I don't think it's recognised enough. And like we could go into the politics of it as well. It's probably best to leave that out. But do they really want to focus on the things that are going to have the cure, rather like health is a business?
Yeah, there's I mean, it's an interesting one, isn't it? It's like we work in the energy sector, and I'm always questionable about why energy prices are so high. There's got to be something going on somewhere that makes that reason. It's probably a similar thing. It's like the prescriptive drugs, as we know. You go to the doctor, you tell them you feel a bit under the weather, you get some antidepressants like that. There's reasons for that. We'll discuss
and also it costs money here, as well. Like people have to take responsibility. So a doctor, I would say like a doctor is not responsible for your health.
No.
Like you are. We're at home and we eat the foods, like we have the late nights, the early mornings, that we need to take responsibility for that.
Choice.
And the doctors can only do that so much. And we do see some GPs now changing it for lifestyle choices. There's a guy, Rangan Chatterjee, who does a podcast and who does some awesome stuff. He's got a GP practice and talks a lot about this integrated medicine. And so I hope that, and I really feel we are going more towards that lifestyle side of things, where doctors won't just prescribe the medicine. They won't just give you loads of antibiotics for no reason and cause more harm than good. They'll actually look at nutrition. But we've still got to think that some of the times people are not taking responsibility. And I always say that we're not responsible for what we've been through. I've been through like panic attacks from being in the corporate world, and obviously lost my dad. Like when you look at like trauma from childhood, different trauma things, severe overtraining, mental health issues when it comes to like disordered eating and all that sort of stuff. And like I'm not responsible necessarily for those things, but I am responsible for how I go forward from this area. I could be a victim to someone that's overworked with stress, but I was 15, I'm 37 now. So I'm not going to change that. So I can use that story of my dad to make sure that I'm doing things can move my health forward and help other people.
I think sometimes it's consistency, isn't it? Consistency. And how hard or how easy do you find that now? Because I mean, good shape, good health, blah blah blah. It's your job, don't get me wrong. So it's part of your job that you need to make sure you look like you're sort of practicing what you preach. I get that, but I speak to so many people that say, you know, they'll join the gym or they'll do this or whatever, or they'll try the things that you are suggesting. How do you get people to a point that actually it just becomes part of their day to day?
I think the hardest thing when you get driven people is they want to do everything. They go from not being able to go to the gym to wanting to go 5 times, and because they can't do that, they end up quitting. And we see it that there's 3 stages of health. When we look at, like, say, there's the stage 1, which is just doing something, like getting your steps in, like eating a little bit healthier, like less processed food, getting hydrated, and that will get you about 80%, like, of where you need to get. And then there's following a specific diet, and maybe a named diet. Maybe you're gonna do some intermittent fasting, maybe you want to go vegan, maybe it's carnivore or something, just to label it to a degree. Like that's going to get another 10-15%. Then there's the 5%, which is I'm going to do all the sexy stuff I can chuck on social media. I'm going to go to ice baths all the time. I'm going to do
enjoy the ice baths.
I do the ice baths all the time. I'm going to go and smash a marathon or an ultra marathon, and then just be burnt out afterwards. And it's the like not the non-sexy, not ugly stuff, the non-sexy stuff,
It's going to have the most
which
impact.
has the most impact because we can do it. And building your routine up is that if we put too much on our plate, we give ourselves an excuse. So subconsciously, it's okay to fail because we're too busy for it. But if I say to you, like, just have an omega-3, like a supplement, every day, then you chuck that by your toothbrush. There's no reason to forget, unless you forget to brush your teeth. But there's no reason for you to forget, so you can't make up the excuse. So it's just that smallest thing to nudge us forward, which is why I prefer to work with people over 6 months, 12 months, with less contact, just to move them in the right direction. Yeah.
Good. And what's next? What does the next 12 months look like?
We're going through some things like family-wise at the moment to say that we want to stay more locally, rather than travelling as much. So I want to be working with more businesses in Norfolk to reach more people. So I want to get more speaking events and stuff like that. But we're launching a group for guys called the Optimal Man Club, which is going to be basically, if you're over 30 guy in Norwich, you've probably been targeted by the video on Facebook at some point.
I have.
So why don't you like it? Help me with me.
I like most of your stuff. So maybe
I'm the one I'm paying you ads for.
I'm going to have to have a look.
When you get targeted again, click
I'm going to have to have a look.
Yeah,
I will.
But that's basically where we're going to get together on a call, accountability call as a group, and we're going to talk sleep. We're going to talk the things that we need to do to move forward. We'll have a topic each month as well, where I'll do some educational stuff, and there'll be Q&As. We'll have a WhatsApp group, and there'll also be kind of an overall gym plan. Like, you can use it if you've got a PT, because I think it's something to realise. I'm not promoting my products as a PT.
No, that's not what you do.
It's much deeper than that, so it can work alongside your PT. I've got clients that have PTs, but if you haven't got one and you've got gym access, you can have a gym program that's in there delivered to an app as well. So it's about that and going in deeper.
If you're targeted by these ads,
please hit like.
I'd be really happy with that, if that's all right. Amazing.
Well, as Chris Reeve would say, the vanity metrics. So
maybe
it's not just about the likes.
I'm going to go and see now. I'll be upset if I haven't been targeted. I'm well over 30, so I should be. Brilliant. And how can people get in contact with you?
Just Instagram, Ollie Matthews Health Coach, or go to olliematthewshealthcoach.com.
Amazing. Ollie, thank you ever so much, mate.
My pleasure.
I very much appreciate you speaking to me. Guys, thank you for joining us for another Swan TV, and we'll be back with another one soon. Cheers.